I think it's important to set the context. There's increasingly a feeling that people providing the services to patients are the best ones to understand how they need to adapt their services to meet the needs of patients. So we want to empower practices to be able to do that. We recognise it's really difficult for them to achieve change at the moment because they're so snowed under with demand and the job is so high pressure, there's so little time to even think, that it's very difficult for practices to change, and for leaders in the practices, be it practice managers or partners or other roles, to actually drive through change. So I think that's a critical area where we need to support practices. I think the protected learning time events are a good start, and I think we need to make sure that the training we deliver in those is targeted on things that are going to be really effective for practices. I think we need to create other opportunities for leaders within practices to get some time out, to be able to just take the space to think about what's required, but also to be able to use that time to give them the skills and support they need to do that. I think we have a real job to do in supporting and developing leadership and management skills in general practice, both for people who are in existing roles, but also for the workforce coming through. I think we need to take real responsibility for recognising as a CCG we have a role to support practices and to encourage them and to empower them to bring through the next generation of leaders, because we're expecting general practice to take more leadership in the future. As we talk about the way the system needs to look, increasingly our role as commissioners will diminish. We will be starting to say, here are the outcomes we need, here are the questions we will ask to monitor it, but you as providers working with the patients at the coalface, we want you to work with your patients to shape your services to meet their needs. How can we support you in doing that? And the practices are going to need to, they're going to have to up their game if they want to do. We think it's the right thing to do. We know that's the national ask. So we're going to need practice to do that. They are going to have to work a bit differently. They're going to have to up their game, so we have to support them in doing that.